Hello friends, welcome to Creative Medicine. In this lecture, we will learn about all are true regarding the events related to oogenesis except in oogenesis, primary oocyte is arrested in prophase at birth. True. LH surge occurs 24 to 48 hours prior to ovulation. First polar body is released before ovulation. Meiosis II is not a reductional division, it is an equational division. In fact, meiosis I is a reductional division. So, reduction division is meiosis I, not the meiosis II. Sperms remain fertile for how many hours in the female genital tract? Sperms remain fertile for 24 to 48 hours in the female genital tract. So, sperms remain alive and motile in the cervical canal and uterus for 5 to 7 days and in fallopian tube for 85 hours. They remain alive and motile in the cervical canal for 5 to 7 days and their sperms remain in fallopian tubes for 85 hours. But they should be fertilized within 24 to 48 hours. Average reproductive span of ovum is 12 to 24 hours. Average reproductive lifespan of ovum is 12 to 24 hours. After oocyte, the ovum remains fertilizable for 48 hours. But in that 48 hours, only the 18 to 24 hours is mostly the chance of fertilization is mostly lost by 18 to 24 hours. So better chance in fertilization is between 12 to 24 hours. If there is no fertilization, the oocyte will disintegrate between 12 to 24 hours after ovulation. Then, how many hours of LH surge does ovulation occur? The ovulation occurs in 24 to 36 hours. Ovulation occurs 24 to 36 hours after LH surge. So, acute rise of LH surge the LH surge or acute rise of LH hormone will trigger the ovulation and development of corpus luteum. So, this LH surge occurs in 34 to 36 hours before ovulation. So, it occurs 34 to 36 hours before ovulation. But some can also say it is 24 to 48 hours before ovulation also. Choose the correct sequence of following embryonic events. So, if you see the sequence, first and foremost there will be acrosomal reaction, followed by cortical reaction, followed by zona reaction will be seen. So, in the reactions, first there is acrosomal reaction, followed by cortical reaction, followed by zona reaction is seen. So what is acrosomal? First, sequence of events of the whole fertilization, if you see, first and foremost there will be zona pellucida will attract the sperms. Then the sperms will bind to the membrane. Once they bind to the membrane, there is acrosomal reaction will occur with the release of sperms. Now the penetration of sperms occurs into the zona pellucida. Once there is release of enzymes from the sperms, there occur penetration of sperms into the zona pellucida. Now the fusion of sperm membrane occurs with the oocyte membrane, and finally release of cortical granules occurs, that is zona reaction, and at the end, that is cortical reaction, and at the end zona pellucida becomes impermeable to the sperms, impermeable to the new sperms, thus preventing polyspermy. Thank you, and thank you for watching.